that we want to talk about very quickly is the Medicare annual wellness visit. This is amazing because this is going to open a tremendous amount of doors for you. Why? Because this instantly could bring in a fortune for that doctor. You see, in 2011, Medicare encouraged 50 million patients, Medicare patients, to do an annual wellness exam. It's very simple. It's not really an exam, it's a questionnaire. And this questionnaire, this information that would come back to Medicare, was designed to reduce the onset of chronic illness, prevent catastrophic accidents, keep patients out of the hospital, and delay long-term care. But the paperwork was so cumbersome that doctors elected not to incorporate it. It just was too time-consuming for the doctors. Well, we at MedX Prime have been working with our provider for the last several months. And we're now rolling out a very simple program that the patient can do very quickly, very easily as they wait for the doctor. You know, let's face it, when we go to see our doctor, doctors often make us wait 20 minutes, 30, 45, hour and a half sometimes because they're running behind. So the nurse now simply says to the patient, while you're waiting for the doctor, we'd like you to take this quick questionnaire that will help the doctor to better treat you. It's very simple. It's done on a tablet. And for that, ladies and gentlemen, Medicare reimburses $175, which of the doctor maintains $135 of that. So let's give you a quick example of what it means for a doctor. You go out there and close a doctor that has Medicare patients, and most practices do. He does this test, if you will, 5 times a day. The receptionist, the nurse hands the tablet to 5 patients that take this exam, this questionnaire. A 20-day work month means an additional revenue for the doctor of $13,500 or annual of $162,000. And by the way, because of this exam and the information gathered, this will actually also trigger another average about $300 in income coming to the doctor from additional services or tests that may be required for that patient. And what does this mean for you? You set up that one doctor who does the 5 tests a day, means additional income for you as a rep of $1,200 or annually about $15,000. Set up 10 practices and you're looking at nearly $150,000. And again, that's only on 5 a day. If that practice does 10 a day or 20 a day, of course you can do the math from there. And this does not include overrides that you earn by your team members going out there and setting up the annual wellness visit with their contacts.